We want to welcome you to this Moral Monday, National Moral Monday, a time of remembrance and mourning. Remembrance and mourning. As more than 25 states and the District of Columbia, people, poor and low wealth people, their allies and religious leaders have donned their mask, have gotten in their cars, and since we can't march in the street, we're driving in the street, and we're remembering those and demanding that this nation stop and remember all the souls that have died, and then mourn their loss, and then be moved to repentance. You can go to the website on the top of the screen to sign our petition from mourning till a moral mandate, where we're calling on the President, the Senate Majority Leader, the Speaker of the House, the President-elect, Vice President-elect, that we must have a comprehensive, just COVID relief bill now. We must have a smooth transition, and we must have a moral agenda at the beginning of the new year and a new administration. Stay tuned, because we're going to be keeping Moral Mondays going for a while. We'll let you know how that's going to happen and proceed, particularly out in the new year. But we cannot continue to have compromise with those who are more interested in forcing one person on the Supreme Court or changing the vote counts of people than they are keeping people out of caskets. There can be no flinching when it comes to a demand that in the name and memory of all those who died, we must live for justice, live for concern, live for truth, and demand a full, comprehensive, and continuing recovery, just recovery plan that will not only move us out of this pandemic, move us out of this economic crisis, but will make it so that it doesn't happen again. When Franklin Delano Roosevelt faced the Great Depression, he had a 3R program. We need the same thing, maybe even 4. We must have recovery from this pandemic. The kind of recovery that people get because they're human beings, not because of the job they have or the money they have. We must have a real dealing with the racial disparities and the economic disparities. I don't know if you all know, but we are finding out from our experts that they don't even keep the data on how this pandemic is affecting poor and low wealth people. They do it by race, but not by economics. And yet we can surmise what's going on. We know that poor and low wealth workers and people are being hit the hardest. We need not only to have a realistic dealing with racial and economic disparities, we must have a reimagination of our financial realities in this country. The reason people are being hit so hard is because they were hit hard before the pandemic ever happened. They didn't have the money for savings. They had healthcare connected to their jobs and not their bodies. They're afraid to go get tested because they can't afford. They're afraid to go to the doctors because they can't afford. And that is horrific in this world that we live in. And then finally, we must have a real dealing with what Liz and I, Reverend Dr. Liz and I have talked about, and that is that this current president and the Senate leader of the Senate, McConnell, and those who've gone along.
He's almost ready to go. John! Ah! Where are you parked at?
Those who've gone along with them have indeed engaged in a form of crimes against humanity. We asked that all of the people who are gathering around the country to do it in the most solemn way. There's no happiness in what we're doing today. I mean, we remember those who have died, but there is a certain sadness because studies tell us out of the 257,000 that have died, 210,000 didn't have to die. So much needless death. And we will not pass by their lives anymore. We will remember their smiles and their tears. We will remember every family and every person and everyone that was created in the image of God. That's all of us. And we will remember them and we will mourn this unnecessary death. But the remembering of them requires that we live for justice and righteousness, that in their memory, we must demand and never give up on this nation doing the right thing. Because if we don't do that, then we become accessories to the crimes against humanity, and that we will not have on our eternal record for no one. I know at least one family in my church that's lost over 12 members. I know one young 18-year-old down in Mississippi, Olivia, who today is helping to lead the Caravans, and she's lost 11 members of her family since March, 11. And in the midst of her tears and her brokenness, she's decided to be a part of the movement, to use their memory to fight for justice and to fight for righteousness. Already thousands have signed on to the petition, so look again at the top of the screen and make sure you send it out, push it out, tell everyone to join us. And then tonight at 6 o'clock, rejoin us when Reverend Dr. Liz and I from the steps of the National City Christian Church in DC will be there virtually. There'll be 2,500 candles lit, and places where you can go and put memory on a wall of remembrance. And since our current national leadership has not stopped to have a day of mourning and eulogy, we will do that, and we will deliver eulogy. I'll be joined by a young African-American woman who is an AME preacher, a Hindu, Unitarian, a Jewish rabbi, a retired pastor, a national leader of a major denomination. Reverend Liz and I will be joined by them as we light candles in remembrance, but also in deep commitment. Because to mourn is to care deeply, and to care so deeply that you seek to do something about the situations that caused the mourning in the first place. This is today, this moral Monday, where we say to the nation, you will not pass over these lives easily. We will not allow their memories just to go away quietly. And in their memory and in their name, and because of our commitment to God and our commitment to the moral arc of the universe, we will never forget, and we will never stop fighting for what is just, what is true, what is merciful, and what is full of grace, and for what ought to be in this nation. Reverend Liz.
Thank you so much, Reverend Barber, and for everyone that's joining us from across the country and world. Thank you mostly to the heroes and heroines in state capitals across this country who are mourning in public, because that's what this time requires. When you go to the website and sign and push out that petition, there's also space for you to add your photos, your names of those that we have lost to this COVID-19 pandemic and to the pandemics of poverty and racism, of ecological devastation and militarism. We'll be unveiling that wall later this week, later next week, but please add your names, add your photos. let us keep on remembering and honoring, and then deciding to take up the fight of so many that have come before us. As Reverend Barbara was saying, the more than 257,000 people who have died are just 4% of the global population, but 20% of the deaths from COVID. This in a country that has the productive capacity, the healthcare capacity to make this all history. These avoidable deaths need to move us to mourn and to keep on organizing and demanding that everybody has a right to live, and that we will commit ourselves every day to making their memory be a blessing on a movement that is growing in power and scope. And so it is now time to pass it back to Reverend Barbara to hear some of the stories of those across the country who are rising up, mourning, and in power, to share with us on this World Monday why we're doing this, what we demand, and how people across the nation in state capitals are committed together.
Thank you, Reverend Liz, and thank you, Reverend Barbara, for that opening. Again, you will have the opportunity to sign the petition at vote.poorpeoplescampaign.org, as well as submit some the names for the mourning wall and photos that will be shown later this week that we'll go live with. We are across the country right now and excited to bring these folks, even as we know that this is a deeply mournful and serious time, seeing some of the stories that we'll hear. We're going to start in Pennsylvania with Janina Gorman. And so if you would bring up Reverend Barbara and Janina to start.
Pennsylvania, welcome you, Janina, to tell us what's going on there.
Hi, my name is Janina Gorman from Altoona, Pennsylvania, and I'm here in front of the state capitol in Harrisburg with our Moral Monday Caravan in their remembrance. We are demanding just COVID relief, a smooth transition, and the implementation of a moral agenda. Here in Pennsylvania, we are demanding urgent release of vulnerable people from prison and that the state budget not be balanced on our backs. People from all over the state, including family members of prisoners, are circling the Capitol in cars, united in these demands. I'm here today because my son contracted COVID in foster care facility 4 hours away from me. I am here for all the families separated from loved ones, whether through the child welfare system, through incarceration, or through immigrant detention. Staff who tested positive for COVID cannot afford the time off and are allowed to return to work, which puts all of our loved ones in danger. And in rural Pennsylvania, where I am from, the few hospitals that haven't been closed are overflowing with COVID patients. I am honored to be a part of this national action today. It gives me strength to continue our fight. Forward together, not one step back.
Thank you, my dear sister from Pennsylvania, and certainly your sentiments register around the world. As we go to our next state in a moment, I want you to know that we have over 8,000 Asian people who have died, many needlessly. We will not accept that. We will remember, but refuse to ever accept it. 46,000 plus Black people, 2,200 indigenous people, 46,000 Latino people, 123,000 white people. And the reason we disaggregate those numbers, because we remember every life. We know that there's disparities. We know Black and brown indigenous people die 3 and 5 to 7 times more. We also know that the largest number of deaths in raw numbers are white. But what we know that's true about most of them is they are poor and low wealth. or they are, as my dear sister just reminded us, those persons who are incarcerated, many of them waiting on trial, some of them they don't have life sentences, and yet because they're being forgotten or because they're being unjustly not cared for, they're dying, and we cannot accept that. We must mourn because our people are no more, and we cannot accept it. Rob, the next state.
Next, we'll be going to Georgia, where Jarvis Jenkins will be speaking to us.
Hello, Jarvis.
Yes, Bishop. My name is Jarvis D. Jenkins. I'm a disabled, retired combat veteran who suffered with PTSD and severe anxiety. And this has touched me personally. My hometown of Albany, Georgia was the hot spot when it first started. During that time frame, I lost 5 of my classmates from high school. The high school I attended in Albany, Georgia was Monroe Senior High School, the only predominantly black high school there and still there. So we would always get together, have lunch, or we would have some kind of event. And now 5 of those persons are no longer with us. And I was looking today, this morning, we got over 400,000 cases in Georgia and almost 9,000 deaths. And I don't want nobody to forget none of those people that we lost during that time. And this has affected me dearly because I'm personally affected by it. It's nothing political about wearing a mask. It's nothing political about social distancing. It's nothing political about washing your hands and stand out of congested areas. The sad part about it was when my classmates were going through this, we couldn't go see them. The only thing we could do was with the nurse on the iPhone, we could talk to them that way. But when it first started in Albany, sir, a lot of my classmates didn't know what was wrong. They just thought they had the flu or fever. And when they got to the hospital, it was too late, Bishop. It was too late. So my thing is this: we need federal help on this COVID relief, and we need to go to these rural areas where they're closing these hospitals, and the ones that are open, they're overflowing. And the people that are taking care of people are running out of equipment, and they're tired, and they don't understand why we're not out here wearing masks and doing the things that we need to do.
That's right.
So anyway, any kind of assistance I can do, I'm out here. I'm out here on this Mall Monday, and I'll be out there whenever y'all need me.
Yes, sir.
Thank
My brother, we thank you for your deep commitment, your personal story, personal love. No, we will not forget. And that's why it makes no sense that we're not talking about it. We're demanding that there must be health care for all and expansion and free treatment and vaccines for everybody. And that we cannot have compromise on the issue of people's lives. These are precious lives we remember and precious lives we mourn. But we don't just do it as an act only today. The nation needs to know that you and so many others, as we remember and mourn today, it is a sign of our commitment to demand a comprehensive, just COVID relief that lasts as long as it needs to last, and a moral agenda going into the new year. And in a moment, we'll review for those online what that agenda is. Go to the website that's going across the screen, and you can read it there and sign up for the petition. Thousands have already done it. Why don't you join us today in this remembrance and mourning? The next state.
Yes, and so we're going to switch one thing. We're going to go to Maryland next, and then followed by Maryland, go to New Hampshire. But if we could go to Maryland, Linnell, if you want to come off mute.
Dear Sister Linnell in Maryland. Is it Linnell or Linnell?
Yes.
Yes.
Over 4,309 people have died in Maryland.
Not me.
And our issue is housing. So pass a stimulus and COVID-19 bill that we can benefit from. And I'd like to tell my story. On February the 12th, 2020, I remember waking up in excruciating pain, especially in my chest. I was coughing up blood and I had a fever and I could barely walk without screaming. I called patient first. They told me to come right in after I explained my symptoms. I was seen immediately. They took my blood work, they did a chest x-ray, and I had a breathing treatment. A doctor and 2 nurses came and walked in, and they were covered from head to toe with protective gear. They weren't like that before I walked in. They told me that I had acute pneumonia in both my lungs and some type of viral infection. My doctor came over to me and hugged me. I had never had a doctor come and hug me at all. I began to cry because I didn't know what was wrong. You know, I was just bewildered. Like, why would a doctor come and hug me? She said, "Mommy, it's a good thing you came here today. I'm so glad you came here. I'm going to send you home with antibiotics, pain medicine, and Tessalon. And I'm going to call you in 3 days, and I want you back in 7 days." I never made it back in 7 days. I came back in 9 days, wound up in ER, went to Johns Hopkins. I had seizures, delirium, everything. There were wall-to-wall people at Johns Hopkins. I waited 8 hours to be seen. 8 hours. There were people in there, Reverend Barbara, who have been there 10 and 12 and 13 hours. They didn't have enough doctors. They didn't have enough nurses. People were laid on the floor, vomiting, coughing. It was a disaster. They called me every 2 hours until my blood pressure just completely dropped. They finally put me in a room. I was hooked up to an IV. I was given all kinds of medicine. And upon all of this, it took me 10 weeks to get on my feet. I lost my job. I lost my insurance. I lost my car. You know, I'm telling you, it was a horrible situation to see all those people and myself lined up on the floor in Johns Hopkins. It was horrible. The president should have told the people about this so the medical system could have benefited and been prepared for this, because they clearly, Johns Hopkins was not prepared that day. And because it was absolutely a mess. And I'm just, and that's my story. And it just goes on and on. Now I have a condition, an autoimmune deficiency. I have severe asthma. My doctor said the best thing to do is to leave the state. I mean, this is how bad it is.
Jesus.
I had to file for Social Security because unemployment took too long. I am upset. My life has been turned upside down. I've worked all my life as a teacher. I wasn't ready to retire, but I had to. And that's the only income I have right now. And I'm just getting strong so I can work. I probably can't work a whole week, but I need to work because my Social Security isn't even enough after I worked all these years. And my retirement doesn't kick in. But that's my story, Reverend Barbara. God bless you. God bless this movement.
God bless you. And the fact that you're telling it right, the lies that were told, you're alive to now fight for those, and you could have been dead.
I thought I was going to die.
That's right.
I had a seizure. I thought I was going to die.
Yeah. And so many have. And that's why we have to fight. This business of one little bill and most of it going toward the corporations is crime against humanity. It's mean. And we cannot let this happen and we be silent. That's why these caravans are happening. That's why we're going to continue. We're not going anywhere.
Yes.
We might not be able to march in the street, but we will not be silent. We will be heard.
No.
We're going to demand of the new administration that they do what needs to be. We demand of this administration, the Congress, because your story is so real. And so many people with that story, they didn't end up even alive. They left here. And now they act as though they want us just to move on and just forget people. No, we can't do that. And we won't do that. And so, my sister, we will carry. Thank you for your courage, your commitment, and thank you that you now say, even though I've been through this, I'm going to use part of my life and my breath to fight that this never happens again. But first, fight that this country does right. And in the name of those who are dead, we must do right for living. God bless you, sister from Maryland. Thank you so much.
Thank you. God
Rob,
bless
I'm going to turn it over now to you and Reverend Liz for here. Brothers and sisters around the country, I just got to step away to get ready for another piece for this movement and this eulogy. But listen, we cannot stop this. Y'all hear these stories, and there are more to come, those of you that are listening in. We cannot, in the name of those who have died, we must live now. We must live and demand that this nation respond properly and repent for its failure, but then respond in repentance with righteous laws and righteous change. We cannot accept this as normal. No way, no time, no way, no time we can accept this as anything like normal or what ought to be. This, what we have seen and are seeing, is a crime against humanity. And yes, I have to use that biblical word that's described. It is evil. And we who know good cannot accept it anymore.
Thank you so much, Reverend Barber, for being with us, and we look forward for everyone to join the National Memorial Interfaith Service tonight at 6 p.m. Eastern, which you'll be able to watch on the website as well. I'm going to pass it to Reverend Dr. Liz Theo Harris, our co-chair, who's going to take us through the next few states. Plenty of states, lots of testimonies to listen to.
So I welcome right now Debbie Apramala from New Hampshire to share why you're with us today and why folks are at the state capitol in New Hampshire. And after Debbie will be Lark from Washington, D.C. Debbie, you're on mute still.
Today I'm at the state capitol of New Hampshire, and we live tribute to the people who have gone on before us. But today in New Hampshire, we're fighting for crisis care plans so that those who are disabled and marginalized get the same treatment of care as everybody else. This is a community that is marginalized, and when we go to the hospital, because we're in that second phase of COVID, the choices will not be the same as for everybody else. They assume the quality of life of the poor and disabled is not the same as everybody else. But I will not be silent. New Hampshire will not be silent. We want care plans that are transparent. We want care plans that families actually understand and know. I am a mother of a severely disabled child, and I will not let someone else determine whether his life has a high enough quality to live. This is happening not in New Hampshire, but across the country. We must rise up and say, everybody means everybody. The poor, the disabled, LGBTQ plus communities, and we don't give you the right to judge for us who shall live and who shall die.
Well, thank you so much for being with us, New Hampshire, for your story, Debbie. And indeed, we are coming together. We're demanding a just relief package, but we're also demanding that everybody's got a right to live and to live with dignity. I'm going to move us along to Virginia. We're going to hear from Maria, who will be translated from Spanish into English by Reverend Leah.
Mi nombre es María Mallorquín y estoy aquí representando a mi esposo Edwin García, que está detenido en la detención de Colville. Desde febrero, él contrajo el COVID. Desde febrero, él contrajo el COVID y como muchas otras personas, un señor ha muerto en esa detención. Por el virus. Necesito a mi esposo en casa. Él era una Él era el sostén de mi familia. Él era una persona de que sostenía a mi familia, mis hijos en casa. Yo sola con mi enfermedad, yo padezco de una condición crónica de lupus y de artritis reumatoide. En mi casa todos y mis hijos salimos contagiados con el COVID. En el verano, demando que liberen a mi esposo, así como estoy yo sufriendo, así están muchas personas y muchas familias sufriendo esa misma situación. Estamos sin dinero, sin renta, sin comida. El gobierno necesita ayudar todas esas personas, pasar un estímulo de alivio de COVID para toda la gente. Necesitamos una transición de líder tranquila, que todos los cautivos sean liberados, que liberen a mi esposo. Necesito a mi esposo en casa.
My name is Maria Mallorquin, and I am here representing my husband, Edwin Garcia, who has been detained in Farmville, Virginia, since February. While inside, he, like many others, contracted COVID-19. People have died of the virus in detention centers already. I need Edwin home. He was our breadwinner. Now alone with my chronic illness, it has been difficult to take care of my house and my children. In the summer, my household contracted COVID-19 as well. We demand that my husband is liberated. Just like my family suffering, there are many families that are in the same situation as we are, without money for rent and food. The government must help us all. They must pass a just COVID relief stimulus for all, a smooth transition, and they must set the captives free. They must bring my husband home. Thank you.
So much to Leo, to Maria, to everyone in Virginia that's a part of the Caravans today and a part of this movement growing. We have so many powerful stories. We have so many people impacted. We're putting a face on all of these truths. And so I'm going to keep us moving. We're going to hear next from folks in North Carolina, from Nestor Gomez, who will share what's happening in Raleigh today at the state capitol and why we're here.
Hello, everyone. Hello, I am Pastor Nestor Gomez. Hello, Reverend Barber, Reverend Liz. If you understand me in my English, I speak in English, but I am here from the legislature in North Carolina. I am pastor. I represented the Latino community here, my organization, Comunidad Vida Nueva, and see. I don't know if the translator is here, maybe for
You
understand.
sound great. You sound great. So if you're up for just going for it.
Okay.
Thank you.
We are here because this weekend, the governor in North Carolina say that we pass the 5,000 people die here in North Carolina. When I listen, for example, some people say in all country we pass 250,000, and some people say, oh, but this is not too much. But the other day I saw one sign that say, how much is too much? And Reverend Barber say, we have one word, when for me, and the word is evil. It's malvado. This is evil because 250,000 people is too many people. Here in North Carolina is very cry because in July, more than 44% of the population in North Carolina infected are Latino people, 44%. The other way is about some people don't receive any help because they are undocumented, don't have documents. For example, in one family, if you are a citizen, the wife, and the husband is undocumented, don't receive help. And the kids are citizen, the wife are citizen, but the husband is undocumented, don't receive help. Personality and end to May, my wife and me, we have COVID. Right now we are fine, but for the May, June, and July, I don't work, but I don't receive any help. In my family, we have 5 kids, but these kids are citizens, but we don't receive help. But this is good testimony for me because I understand my community, and we fight together with Latino, brown, black, African American. We need, work together and fight together because this system is evil. It's malvado, it's evil because the Bible say that we are blessing when we bless other people. I am very proof for example, AME Church, that we work together for help and assist people, but we don't receive, for my community, don't receive any help. But thank you, Reverend Barber. Thank you, Rev Liz. We are here in North Carolina and fight together and say, raise up, raise up. Thank you.
Thank you so much, Pastor Nestor. We hear you. We hear you when you say that it didn't have to be this way. What we know from Harvard University is that Latinos are dying 7 to 9 times more than white people are of their same age group, and that 10,000 Latinos did not need to die, died unneedlessly because of the way that this administration, this society has treated and has not treated this virus, and poor and people of color are so disproportionately impacted by this, and we've seen also in this pandemic that it doesn't have to be this way, that this lie of scarcity is just that, it's a lie. And so thank you so much for being here, and thanks everybody for being here. We're going to move to Massachusetts, to Maria Colville, who will share why she's involved, how she's impacted, and what folk are doing in Massachusetts at the state capitol there. Maria, it's so good to have you.
Thank you. Can you hear me?
You sound strong.
Okay, great. Hi, my name is Maria Colville. We are at the State House. I've been a PCA, not a PCA, but a home healthcare worker for over 30 years. And with this COVID-19, I've lost close friends, I've lost church members, I've lost connections with people on staff. It's just a terrible thing. This COVID-19 pandemic is the first or the priority pandemic right now. But we are actually going through a tridemic. The fact of the matter is, we have the sickness that we have to deal with as priority, but we have systemic racism. And then we have the fact that there is not the truth being spoken to the people. Truth is a solution to everything. Because if we know what we're dealing with and how we're able to understand it, then we can apply the right solutions. As far as I know, in the law, once you premeditate the death of a person and then they are killed, that is murder. What we are dealing with right now is a genocide. How can we have a leadership who knows how deadly this is and is just making promises and not giving any help. And what they're disguising as help right now is a debt at the end of it for people they're giving what they think to be handouts. We are paying taxes every single time we work. That taxes, we put them in place to make sure that when the people needs help, the people get that help. Not with a balloon payment later on, not with an advance loan. Help without indebtedness. There is no profit for any people or any nation if they don't take care of the people first. People before profit. People are dying every single day. Who is going to be charged with murder for their death? Because they know that this is deadly and they are not giving us any help. You're bailing out companies for millions of dollars and people are dying and suffering. Hospitals are overwhelmed. There's not enough PPE. What are you doing? I am calling on the conscience of the leaders in our country called America. What are you doing? How many people have to die before you take action? You are going on leave in a little while, and every day you're in your house with your families, people are dying. Stop promising and do the right thing. Yes. Stop making promises that you're not willing to keep. Nobody is responsible for the crisis that we're in right here, right now in America, other than our leading officials that we elected, that is supposed to be there to help the people, so in turn the people can help the upliftment of this nation. Every person that dies from this COVID-19 because you want help, you have committed murder. Every day that people die, you as our leadership have committed murder and genocide. Stop the death. We are not padding your pockets with our blood. Enough is enough. Do something. Not when you come back from vacation, but do something now. People are dying. It is literally a matter of life and death.
Thank you, Maria. Thank you, Maria. And thank you, Reverend Liz, for that. We appreciate it. We have to move to the next one. We have a lot of folks. Thank you. To Maine.
It's her. Yeah, because they told me to turn it around.
Oh, okay. So Aubrey Trout, will you share? Now we can you hear me? Okay, yes. Good. Yes, I'm Aubrey Trout. We are demanding, we are mourning today, driving around the Augusta, Maine Capitol. We are about 15 cars strong, I would say. I myself, when it comes to the effects of the pandemic and no stimulus being passed, I am 37 years old. I'm a single mother. I'm on an unemployment for the first time in my life. My daughter and I are living at home with my parents who are helping us make it. And today, along, as I said, we're mourning, we're demanding, trying to hold our legislators accountable. We need a stimulus passed now. Things are hard for me and I have help. I can't imagine what it must be like not to have that. Sorry. You're good. You're good. So we're with you. It's hard. It's hard, you know, $187 a week. And like I say, I have help, but my, since the, extra, COVID relief money ended last July, I get $187 a week, which is about 2 trips to the grocery store, maybe a tank of gas. And I can't imagine not what it must be like for so many people who have it worse than I do. So we are here. We are, got my bullhorn. We're singing, we're driving, we're honking, and letting everybody know that we're not going anywhere, and we're going to keep our eyes on the prize and organize. And we're doing it. As I say, we're about here in Maine, Little Augusta, Maine. We're about 15 or so cars strong. And
Well, Maine, you're not alone. We have people all over the country who are mourning and organizing. And thank you so much, Aubrey, for everything you do and for coming into this fight and doing it with us. And so I'm going to now connect with your sisters, your brothers and sisters out in Mississippi. Olivia Womack and Leah Campbell, can you tell us what's going on in Mississippi and why we have to continue this fight?
Yes. Good afternoon, Reverend Liz and everyone across the country. Olivia and I are here riding in our caravan around the state capitol and around downtown Jackson.
If you'll move your camera so that you're right side up. I don't think you just turn your camera straight up.
There we go. That's perfect.
That better?
You have to go back and forth. We lost your video. There you are.
There you are.
Okay. So we're here in Mississippi, which is one of the poorest states in the United States, and our governor was the last to enact a mask mandate and the first to lift a mask mandate. The state legislature and our governor have done nothing to help or to protect our citizens. And as a result, almost 3,600 Mississippians have died as a result of their inaction and their inhumanity. And with me today is Olivia Womack, and she is a freshman student at University of Mississippi. And 11 of her family members have passed away as a result of their inaction and inhumanity. And so I'm going to turn it over to Olivia.
Thank you so much.
Hello, my name is Olivia, she said. And over the last couple of, the last year, it's been really, really, really stressful with everything going on. Personally, I had to miss the latter half of my high school senior year, so there was no track being done there. And I guess you could say that we missed the freshman year of college because there's nothing really going on. It's really sad to see what's not been going on, but it's also really, really sad about the loss of 11 people in my family. I had to take a passport basically and count those people because my cousins, they continue to talk about the fact that their aunties and uncles have died, and it's really stressful and sad to listen to them talk about how they weren't able to see them or how they had to give their last message and they never got to see their mother or father again before they died. It's really sad, and the thing that makes it even more angry, the fact to see that people aren't walking around with masks and they're not social distancing in the way that they should. But at the same time, you can't be mad at them in per se because they have to work. There's no way else that they can do anything. So I think that we should have something done so people can be able to stay in their houses, so then other people won't have to die and they won't have to see their family members have their last breath drawn. Yeah.
No, that's right. That's right. Well, you also, Olivia, thank you for sharing your story. Thank you for the work that people are doing in Mississippi, and we need to keep up this work and keep up the pressure because that's right. People should not have to choose between going back to work and having a place to live. Going to move to Bianca Richardson in South Carolina. South Carolina is going strong. Can you tell us how things are going and why you're here with us and your story today?
Hi. I am so elated for this event. This is amazing. Not only are we mourning, but we are also demanding. So in the state of South Carolina, we have had 4,283 deaths so far. Which is a pretty large number. People of color are 3 times more likely to die of COVID than other ethnicities. This is due to, of course, systemic racism, which we've had that issue for a while in multiple entities in our healthcare system, judicial system, and counting. but also some of the other pre-existing conditions that are in people of color. And a little bit about, I guess, my story and why I'm involved. And these statistics are from I actually buried my aunt on November 2nd. My aunt, she was a martyr of the Charleston community. She had a restaurant that fed many people from across this world. And I lost my aunt due to COVID on November 2nd, and we buried her. I can't tell you how that death has affected my family tremendously. Granted, she did have some other pre-existing conditions, such as some issues with her kidneys, but COVID definitely kind of just took her out. And secondly, I think I have a nonprofit called Love Yourself. And Love Yourself is a nonprofit that encourages young kids, primarily young girls, through self-esteem building. So we cover everything from up under skincare, hair care, nail care, the importance of financial literacy and higher education. But one of the events that the kids in the community look forward to, we have an annual summer camp. And this is a safe haven for these kids. And a lot of people, you would be surprised that sometimes when these kids go to school, they go to summer camps, not only is it a safe place for these children emotionally, physically, financially, and spiritually, but sometimes it's the only place that some of these kids can actually get a hot meal. And Corona has it's wiped all of those events out. Events cannot even be held. So with some of the demands that South Carolina has, this is a letter from In Coronavirus SC. And so number one, and this is a letter to Governor McMaster. It's number one, collaborate with local governments, maximize social distancing, expand mask beyond usage, deploy approaches that have worked elsewhere to scale up testing. Number five, to leverage volunteers to scale up contact during tracing. 6, convert unused college dormitories into voluntary isolation facilities. And number 7, implement importation of new cases. And so those are some of the demands that South Carolina has written to our Governor McMaster. And the last thing, beyond systemic racism, is, as we transition to this new administration, I can't express enough the demand, and I know it's worldwide, it's definitely national, and we want to put an emphasis on the immediate demand of COVID relief efforts and also a smooth and open transition and some level of transparency that we have not had in this current crazy, brash, whatever you want to think of administration. So I am Bianca from SC. You guys stay safe. My condolences to everyone. This is not an isolated issue, as everyone knows. My prayers, condolences, and we're in this fight together, and we're going to continue to fight.
Thank you so much, Bianca. And just want to remind folks that are following along online that you can go to vote.poorpeoplescampaign.org and sign the petition, and to also add your photos and the names of those that you have lost. I'm going to move us now to Vicky Barrios out of New York. Vicky, we're welcome. Vicky, do we have you? We also here you go. All right.
This is Kate. I am actually not Vicky. Unfortunately, Vicky could not be with us. My name is Katie Carroll. I'm calling in from New York State. I'm in Albany, the capital of New York. I'm a member of the Capital Region Poor People's Campaign, and I'm really just so pleased to be on this call with everyone today. I want everyone to know that New York stands in solidarity with every other state in the work that we're doing. So behind me is our state capitol and our cemetery that we've erected to acknowledge the people that we've lost to poverty and to the coronavirus, essential workers, included nurses without PPE, people on the front lines, individuals that we've loved and lost. Again, my name's Katie. We are calling on the state, and it's shameful that we live in such a wealthy state, the state of New York. It's terrible that there's just so much wealth here, and people are living in such horrible, stringent conditions. We're calling for housing for the houseless. We're calling for an end to evictions, for rent relief, for fair relief for COVID, for adequate protection of frontline workers, especially nurses and healthcare workers and home care workers that keep people in our homes. I come to this movement as a member of the disability community. In my life as a disability rights activist, I've come to understand the effect of ableism and institutional bias against disabled people. Our society has yet to learn that just because that you do not have to live in a segregated setting, a congregate setting, just because
I think we may have kind of had a not great connection with you, Katie. Thank you so much for being here, for the powerful cemetery, for the powerful witness. I think what we want to also show here is that this is happening all over the country. We're doing these caravans at state capitals, and you can see some of them now. Again, in 25 different state capitals in Washington, D.C., folk are coming together with this petition, with power. You know, we're mourning, we're saying we need a smooth transition, and we're coming forward with demands for a just relief package and for the first policies of the new administration to be about lifting the load of poverty, about protecting essential workers, about expanding healthcare, about all of the demands that we in this campaign have. And so there's amazing organizing, folks all over the country in state capitals, and it's amazing to be here with everybody today. Just look at this, take this in, and make sure that you're pushing it out, the petition over social media, make sure that you're sharing your names. And we're gonna, because we have so many of these compelling stories, so many more states to hear from, I'm gonna keep us moving, and we're gonna now go to West Virginia. We're gonna hear from Pam Garrison out of West Virginia, sharing with us now.
Hello, this is Pam. We're here in Charleston, West Virginia. I am just, my heart is just filled. You wouldn't believe, Liz, how many cars for little old West Virginia this time that we've got here. We've got a hearse in our caravan. This is just overwhelming, the sadness, and then seeing these pictures and these names. And here in West Virginia, we're almost 700 of us has perished now. Our governor just a week ago issued a mask mandate. Finally, our numbers has went up. We've broke records for the last 10 days. Our prisons has had one outbreak after another. Stevens Prison, after it's got 300 and some prisoners, 200 and some of them has COVID. We're still trying to get our governor from the last stimulus bill to give the kids a clothing voucher. We live in mountains. It's getting winter. Kids need clothes. They need winter coats. I'm unemployed right now. I'm a self-employed housekeeper. You know, we can't put ourselves in that kind of risk going out. So we're struggling, and the poverty level is set low, so low. My husband gets $1,000 a month Social Security for the two of us to live on for a month, and we make too much to get food stamps. You know, it's just, and now I can't work to help us. My daughter is in one of the COVID hospitals down here. I think our country is struggling with, we're all having PTSD. You know, we're all under post-traumatic stress from this, and all of our leaders are MIA. Ours down here seems like they've been MIA since it started. Our leaders in Washington has been MIA since this started. We are sad and we're angry, and we demand justice. We demand justice for our dead. We demand justice for our living. And so we are here, and we ain't going away. We are not going away, people. We are going to keep fighting until we get what we deserve. It is our government. It is our country. And these are our people. And I want everyone to know that West Virginia is proud, mountaineer, strong, and we are here. And we are demanding. We're not asking. We are demanding. I am so angry. And I am so sad. And my heart, I wrote on my car, I've got 600 names on, not their names. They won't even give them a name. I got numbers and gender, but these ain't just numbers. These are husbands, wives, kids, grandpas, grandmas. You know, these are more than one family member dying, and a funeral, one person can't hardly afford one funeral, much less 2, 3, 4. Can you imagine what these people are facing trying to put their people away right? And we ain't even heard nothing about no help to even help nobody put their families away. And so, Liz, I want you to know I'm with West Virginia Poor Peoples all the way, honey, and we are here. Thank you.
We are here. We are here. We are strong. We're not going anywhere. And thank you, Pam. Thank you, West Virginia. Thank you for everyone across this country who are indeed saying, you know, in their remembrance, we have to keep this work going. We have to make sure that our political leaders reject a politics of austerity. And we have to keep on organizing. So I'm going to move us to Ohio now. Ohio, we're going to hear Chris Williams. Welcome. Let us know what's happening in Ohio and what's going on for you.
How's it going? So yeah, I'm right now. I'm in front of the. Forgive me if I get choked up. All these testimonies really got me. Kind of threw me off. I thought I was going to be strong enough to, you know, hold it back and, you know, be that strong person for all these people in this beautiful city. But I'm in front of the state capitol where, you know, it once was a place of peaceful protest, and, you know, a lot of people were just mistreated by our own just local, you know, government and things of that nature. We got about 6,000 people we have got 6,000 people that's already died in the state of Ohio. Here in Columbus, Franklin County, we became the first county in the state of Ohio to get on purple status, and I'm just a little bit discouraged by our leadership. We'd rather argue about restaurants and bars being open than the lives of the people in this city. I personally work with the youth and young people, and they're the ones on the front lines keeping these bars and restaurants operating. And to know that 30% of the state of Ohio is 200% under the poverty line is astronomical. And it's just real disheartening. I've lost my grandfather to this. I couldn't go to his funeral because someone else in my family had contracted COVID and had contracted it from another COVID related death and was at the funeral and got it. So we're just demanding our leadership to step up, and we're uplifting those in our communities. We're I just want to see change. I want to see real action. The city of Columbus, the state of Ohio, as we know in this country, a lot of people look to for guidance, and we started off, I felt real well, but I think we backslid, and I think we just really need people to step up. And then I'm also too, we got a nice group of people out here in our caravans, but as I stated earlier, I do believe that some of our people in this city are afraid to even come out and peacefully protest, because in the last peaceful protest we had, people were beaten, people were mistreated, there was bloodshed. And then also too, with our poverty rates, I'm speaking I'm 200% of the poverty line, but yet I have the privilege to have a vehicle and to drive around and have a voice for those that don't have a voice. But most of the people that live in poverty don't have, meaningful transportation. And it's an issue. And there's just a lot of things that need to be done. I think we all know that we need some type of relief from our leaders. And, we need to get out of the shadows and really start making some change. So, I'm just really grateful to have an opportunity to speak on the behalf of Ohio. And, I think we have a lot of courageous people in this city that just need to stand up and live what they preach and just do the right thing. And I'm just really burdened that so many people have died in this state. And I have students whose families have died, numbers of students who have contracted COVID from this because they're on the front lines trying to put food on the table, because their parents have been, let go on their jobs. Not to mention the lack of technical support for our young people in the schools, or the fact that in the state of Ohio, we even have young people in the schools without, real relief or care, and a plan. It's just a lot of talk. And so I just want to uplift those, and I want to mourn with those who've lost family members, who lost loved ones, those who aren't able to work. I just encourage anyone on this call, if you can do anything for the next person, just do it. Don't question it. Just do it. And, because if our leadership doesn't want to take accountability, it's going to have to be us, the people. I think that we can do it if we can all come together and put our biases aside and just love one another. And, I just want to see real action. So again, thank you all for just allowing me to speak. And, we're going to make some change here in the state of Ohio. And we just encourage you all to, band together and, do the things that we know need to get done.
That's right. That's right. We do know what needs to get done. And thank you so much, Chris, for those heartfelt words, the testimonies, and the analysis of what's happening in Ohio. And it's as we all know, happening across the country. Reverend Barber opened us up, reminding us that 257,000 people have died in the United States. 12 million infected by this virus. And Columbia University tells us that upwards of 210,000 of those people did not need to die. But it's really the inaction, the ineptitude, the irresponsibility of our elected leadership. And so we still have more states to hear from. And this is a powerful day of caravans, of a Moral Monday, of us raising, these demands and indeed doing this in remembrance of those who have come before, those who have been lost to this awful pandemic and to the pandemics of injustice. So we're going to move to Delaware now. Reina Bahena Alvarez, we're ready to welcome you. Thanks for being here and share with us what's happening in Delaware. I do not hear you yet.
Let's come back to Delaware.
Charito. ¿Ya? ¿No?
Charito, are you ready? Are you there?
¿Qué dice? Hi. ¿Reina? No.
¿Reina?
No. Reina. ¿Te están diciendo Reina? Déjame, no lo escucho. Ponte el uno, ponte el otro. Yo tengo el uno.
Is Reina able to talk?
Yes, she is.
All right. Welcome, Delaware.
¿Estás conectado o no? ¿Bueno? ¿Sí? Ya, sí, aquí estamos, mira. Ya, Reina, bueno. Di, yo te traigo.
Hola, yo soy Reina. ¿Ya hablo?
Sí, por favor.
Sí, por favor.
Bueno, yo estoy en esta caravana porque estoy... Mi esposo pagó con su vida en este COVID-19 debido a que la empresa no se preparó para recibir, para podernos proteger a nosotros como trabajadores en la empresa avícola.
Okay. My husband paid with his life because the poultry industry did not want to prepare enough for the COVID.
Sí, la empresa no se preparó para podernos proteger a nosotros como sus trabajadores. Y le pedimos, estamos aquí, estoy para pedir el paquete de estímulos para el COVID-19, porque creo que es un derecho para todos nosotros los hispanos, con documentos y sin documentos, porque estamos trabajando para este país.
I here to demand that we, the Latinos, also receive the stimulus package because we contribute. We are here to provide services to this country. We deserve to have a stimulus package because we have been affected by COVID. Sí.
Creo que ese es un derecho que tenemos porque nosotros trabajamos y participamos para este país.
I think this is a right that we have because we contribute, we work for this country. Sigue. Yo amo este país.
Yo estoy muy contenta en este país porque me abrieron sus brazos, porque, pero mi familia está en México y yo necesito que me sigan apoyando porque mi vida ya no es la misma ahorita que mi esposo ya no está aquí conmigo.
I love this country, but my life has changed now that my family is gone. And I need support like anybody that have lost their loved ones. Okay.
¿Corto?
Mm-hmm. This is what Reina had to say. We were here with 15 more cars all over, and we have received the support of the religious community, the grassroots people, and we were all diverse and represented in this caravan.
Thank you so much, Reina. Thank you, Charito. You all are not alone in Delaware. We have your back, and you have ours. We thank you for sharing your words today, and we mourn with you. We mourn with you. I'm going to move us to Kentucky now, and I'm going to have welcome Darlene Brahman to join us right now.
Yeah.
Hello.
Hello.
Can you hear me?
You sound good.
Okay, you ready?
Please share with us.
Okay, my name's Darlene Branham. I'm from Woodburn, Kentucky, which is around Bowling Green, Warren County, hot spot, USA. I had COVID in March, April, and May. Couldn't work, of course. Haven't been doing much work since then. I haven't got the first stimulus check, so hopefully getting ready to hopefully get a non-second one. I've lost family, friends. We're in Frankfort, Kentucky. Oh, we're in front of the Mitch McConnell building, and doesn't seem to be anybody working. Of course, people are driving by telling us to get a job, and they're not working either. So I appreciate y'all letting me get on here and speak, and I appreciate what y'all are doing. I guess what I'm doing. And we got an excellent governor. He tries his best, but these people don't listen. They won't wear their mask. They fight it tooth and nail. So I don't know what's going to happen. It's just getting worse. I lost a cousin last week to COVID that was in a nursing home. So I don't know what else to say.
Well, Darlene, we thank you for being here with us, and we thank the Kentucky Poor People's Campaign, who has been strong, was the reason we called for these Moral Monday events in the first place, and thank you for being here. I want to remind folks one more time that we have a petition. Please, if you're joining us, sign that petition, push that petition out, and please add the names and the photos of those that you have lost. While we'll be unveiling that later this week or next week, but please continue to add more names, more stories, more of this reality. We still have some more states to go. I'm going to have us go to Iowa, and after Iowa, we'll be in Arkansas and Kansas and Alabama. We thank everybody for joining us, and we mostly thank the folks that are out there in the snow, in the rain, in all of these situations. So Aisha, can you tell us what's happening in Iowa? Welcome.
Welcome. Thank you, Reverend Liz. My name is Aisha Farrow. I live in Norwalk, Iowa. Right now, Warren County, the county I live in, has a positivity rate of over 18.8%. 93 of the 99 counties here in Iowa have a positivity rate over 15%. A metric that our governor, Kim Reynolds, mandated that was a level that she would start taking classes online and instituting other mitigation measures. This is not happening. With every passing day, more and more people get infected. I'm here to remember somebody who was like a second mother to me, someone who taught me about service and giving to others. Her name is Clemencia Hepperly. She came here in 1979. She is one of the 2,201 Iowans who will not have a spot at the table. Their chairs will be empty. While our infection rate rises every day, our governor placates us with half measures. I'm here for justice for all workers who don't have jobs to go to. We need justice for those who still work, but yet their lives are treated as though they're indispensable, like those who are working at the Tyson plant in Waterloo, where supervisors actually took bets to see which employees would contract COVID-19. We need justice for the countless and thousands of Iowans who are falling deeper and deeper into poverty due to systemic racism and other interlocking injustices. We need justice for all of the Iowans who are experiencing poverty right now for the first time ever in their lives. But you know what? This is a time of Jubilee. This is Jubilee. It's time to put aside red, to put aside blue, and to just be Americans. Clemencia loved light towers, because they were the lone beacon in the dark for the weary. I want Iowa to be that beacon for the world. We need to come together through love of our community. We can come through to the other side. And I'm so happy to be here today with all of you. Forward together, not one step back.
Thank you so much, Aisha. Indeed, we are moving forward together, not one step back. And throughout the snow, y'all are definitely a lighthouse for us all. Moving to Arkansas, I welcome Bobby Taylor. Please share with us what's happening in Arkansas and why you're here with us today.
Hi, my name is Bobby Taylor. We're here at the state capitol mourning the death of life that we have lost here in Arkansas to COVID-19. We have been neglected by our governor. COVID-19 has impacted all of our lives. Lost family members, lost jobs, lost income, lost places to live. COVID-19 have changed the face of Arkansas. It's not about low income, people are dying. No time to wait, Governor. Someone just lost their life. We need relief and we need it now. You have the resources. We want relief. Now, what's going to happen after December the 31st when the moratorium is over and people don't have no place to live? We need relief and we need it now. Governor Asa Hutchinson, hear us. People in Arkansas are suffering. You have the resources. Take care, look out for your people. We are the ones that put you in office. Help us. We're asking you. COVID have changed the face of Arkansas. So we're asking you, Governor, hear us. We need help and we need it now.
Thank you so much.
Together, not one step back.
Not one step back. Not one step back. Thank you, Arkansas. Thank you, Bobby Taylor. We want to show y'all again one more time the powerful caravans that are happening again in 25 states and in Washington, D.C. People at state capitals with signs, with the names of people that have lost, with the demands that we're rising up around, right? Demands for expanding healthcare and for living wages, demands about housing, and a just stimulus bill. And we are indeed rising up. We still have powerful testimonies from a number of different states, and what we want to do is move on to Kansas. Oshara Misha, we welcome you. We're glad that you're here with us, and please tell us what's going on in Kansas.
Hey, thank you. We're coming from Kansas, and just want to let you know that we are
mourning the deaths of the people that we have lost to COVID in this state. We've had over 130,000 cases. We've lost over 1,400 people who have actually died in Kansas. Not only that, and we definitely mourn the deaths, but we also have a lot of people being affected in different kinds of ways too. People's are getting their utilities cut off. Over 27,000 people have had their utilities cut off right in the middle of the pandemic. Some people are losing their housing, and we're all in the middle of the pandemic, and people are dying. And we would really love to have COVID relief. We recognize that the federal government has given trillions of dollars to corporations, but the little people, the people that don't have any money, they need the help, and we all need the help, and we all need to make it through this because we're all here together. And we just want to give tribute to the people who have passed away from COVID. And we're just asking for a justice COVID relief package for all of us. And we all want justice for all of us. And it doesn't have to be this way. We can have justice for all of us.
That's right. That's right. Thank you so much, Ashara, and to everybody in Kansas. It does not have to be this way. We can choose to do better. And we're calling on all our administration, those that are in power now and those that will be in power in January, to do better. We're going to move to Alabama. Wanda, Bryant, we welcome you. Please share with us what's going on in Alabama and the freedom fighting you're doing there.
Hi, I'm Wanda Bryant. I'm one of the tri-chairs here in Alabama, and I'm 62 years old. I'm taking care of 3 of my grandkids, and COVID-19 has put a strain on millions of poor and working people in this country. As with everything else, poor people are hit first and the hardest. Like so many people that I know personally, I fit in this category. When the school closed as a result of the pandemic, I was forced to oversee the virtual learning. I had to make a decision on whether I wanted to send my kids back for in-learning or virtual learning. And because I wasn't comfortable with their plan, I chose to do virtual learning. The virtual learning has caused me very bad income. It has changed drastically, and it has put a lot of stress on me because you never know this month what you're going to pay or what's going to come off. So it's just something needs to be done with some kind of COVID relief stimulus fund to help people like us. And I'm here today to mourn and grieve for people, the low income and low wealth people, and the people who have been affected by the COVID virus.
That's right. Well, thank you so much for being here, Wanda. Thank you for being a tri-chair of the Poor People's Campaign in Alabama and for all the work you're doing. I'm gonna move us to Texas right now. Beverly Akumo, we'd love to hear what's happening in Texas. Beverly, are you with us? There we go.
Yeah, hold on. Oh, dear. Wait a minute. My name is Beverly Okumu, and I have been homeless in Austin for 2 years because I've been targeted for destitute by Indiana and Texas with systemic racism. I am living in a Salvation Army COVID-19 motel due to COVID-19 being detected inside the Salvation Army. Now, caseworkers and case managers have not even helped me to obtain a birth certificate from Indiana, and I cannot access any services in Texas without it. Yet the city of Austin is telling us that we need to leave the motels by December 15th, during the coldest month of the year and right in the middle of the holidays. And most of us don't have anywhere to go, but back to the streets. Are they trying to add us to the COVID-19 mortality rate? Do we want to be a morally bankrupt country? A country is best judged by how it treats its most vulnerable citizens.
That's right.
And our state and national leaders must do better. 2 steps forward, no steps back. Not 1 step back. This country says, God bless America. If you want God to bless America, We need to do better by our citizens. We cannot outgive God. God gives more than anybody. If we give, he will give more. Thank you. Thank you, Jesus. God bless America. God bless the Poor People's Campaign.
Thank you so much, Beverly. Thank you to everybody in Texas. Indeed, what we're hearing about the situation you're in, Beverly, in terms of homeless folk that are being turned out on the street in the holiday seasons, this is not right. This is not just, and it doesn't have to be this way. I want us to move to Utah. Marcus Pegasus, can you share with us about what's going on in Utah? We see you strong.
Good. Can you hear me?
You sound good.
Okay, great. So I'm here on stolen land. This is the state capital, but it is traditionally Goshute land and Eastern Shoshone, as well as our neighbors, the Paiutes and the Utes. Utah's named after the Utes. Here at this capital, they need to do a lot more work to help us out, all the people that are suffering from coronavirus. And we've been focused a lot on the people that are dying in our prisons and jails. We have 700 people that are infected in the jails here, and we've got 7 people that have died. It's about 2 dying every week here in Utah in our prisons and jails. And this is totally unacceptable, of course. And so that's one of the things that we're focused on here. We've got 793 people dead so far for the, I don't know if you can see that, for the whole state in this pandemic. And as you see at the end, there's a question mark as we're mourning today, because we don't know how many more, and we can change that. And that's why we're here, to mourn and to organize and to uplift the stories. It's been really great to hear everybody's stories today. So touching. It's heart-wrenching. So thank you, everybody. Thank you, Reverend Liz and Reverend Barber, for what you guys are doing too. Thank you for the support, and we're going to do this together. Forward together.
Not one step back. Thank you so
Amen.
much, Utah. It's good to have Utah represented in this campaign and in this country. I'm going to have us go to Colorado. Michelle Diane, if you could share with us your story from Colorado.
All right, Pegasus, good job.
Michelle, are you there from Colorado? All right, we'll go to California and then we'll come back to Colorado. Jamelia Land from California, can you share what's happening out west in California with us today?
Okay, so I'm Faye Wilson Kennedy, one of the co-chairs. We would like to thank Jamelia for coming to join us. She's going to tell us her story. We have more than 70 cars here today, so Jamelia, come and share your family's story. We know it's a difficult story for you, but come and share with us. Thank you very much.
Thank you, Faye, and thank you, Jamelia.
Good afternoon, everyone. My name is Jamelia Land. I am a survivor of COVID-19. March of this year, I was diagnosed. I've been hospitalized 3 times since July 16, 2020. My father, Willie Elvin Land, died from COVID while in a nursing facility. I just want to tell everyone that, this is a critical time for us in our communities right now, that COVID-19 is very real. It is impacting people across the country. For those who don't believe it, for those who refuse to wear masks, for those who continue to engage in behaviors that put us all at risk, when you do that, please stop and think that there are people like myself and like my father who are losing their lives. I never had a chance to tell my father I loved him. I never had a chance to say goodbye. He was diagnosed July 10th. By July 16th, he was gone. So it is real. And I just thank you all so much for giving me the opportunity to be able to share my father. I was my father's only child, and I loved him dearly.
Thank you so much, Jamelia. Our heart goes out to you and to the hundreds of thousands who have lost loved ones. This is why we must keep organizing. This is why we're doing these caravans, why we're remembering. I want to see if we have Colorado. Michelle, are you with us? I know there's been a powerful caravan in Colorado. I just don't know if we're connected right now. All right, so we're going to move to Washington, D.C., our nation's capital. Lark, welcome. Please share with us your story.
Hi. Yes, I had the wonderful opportunity to talk about my mother's story a little over a year ago in D.C. when you guys were here. This is just a reminder. This is my mother and me. And during that time, it was the conversation was trying to bring her back in DC. Sadly, 2 weeks ago, my mother, though, died of COVID-19. She was 91 years old. And honestly, when we say the words no justice, no peace, that's been my life. I've had no peace for the longest time, only because I've had no justice for her. And for her to be, she was a state of the ward, and I didn't have much say in her health and her well-being. And now that she's gone, I have no inheritance, and it's, I have no job. My kids, they're struggling in school. So it's just really, it's really hard for me to continue on and to have no voice, to have no say. When it comes to even with my own family, I don't even know when I'm going to get her ashes. Any of her wishes weren't granted, and yeah, it's just been generally very tough. And to this point, and to all the wonderful states out there, I hope not only you guys keep on advocating in your own home state, but also continue advocating within your local politicians, because they really need to cancel the rent, cancel the mortgage. They need to guarantee health care for everyone, make sure this virus is free so everyone can be healthy and be able to survive this pandemic. But it's truly shown the disparities that have been out there for the longest, and it's just questioned many Black and poor and brown people for the longest time, and they're just wiping us out, and they don't care two shits about it. They just only care about the mighty dollar and over our lives. So thank you for this opportunity.
Thank you so much, Lark, and our heart breaks with you. We want to finish up at National City Christian Church, and so I turn it to Zilla Wesley, one of the chairs of the work in Washington, D.C. Zilla.
Hello, everyone. Can you hear me?
You can.
So we are getting ready for tonight's event at 6 p.m. We are putting our candles out to represent all the people that have passed away due to this COVID-19 or this healthcare system. In DC itself, we lost over 600 people to date. I know personally myself, I know 33 people who passed away from this or poverty. We are working on a banner of pictures that were sent to us earlier, and you will see that tonight, of people we lost, of stories we lost, because this is Thanksgiving that we're about to go into, and it's supposed to be a time of plenty and family and joy, but a lot of people will be missing at different tables for different reasons. Just for one, for us to keep our people safe. And also DC, we're at National City Church. It's in the middle because DC is not a state. And so we need help on all sorts of fashion. You heard from Lark and her story, but her stories are like many other stories. Like I got a call today, people need food. People are hungry. Our money is not coming. We really just need help. So tune in. And also we're in collective mourning, and we are in a place where we just need to rise up together and just love each other and really support each other in this time, because we need to mourn our losses, because we haven't since this whole pandemic has started. And today is a time where we come together at 6 p.m. Eastern Standard Time for us to just really have a collective cry, a collective acknowledgement of all the loss that we have. And it seems like people are okay with this loss, and we are not expendable people. So thank you.
Thank you so much, Zilla. Thank you for the work that's happening. And we do hope folks do join us at 6 o'clock for this national memorial. We have found our friends in Colorado. So Michelle, I'm hoping you can share with us what's happening in Colorado with us today.
Hi, you guys. I'm sorry. This has been like so wild with the electronics. Like the rest of y'all, we're out here today because our hearts are broken.
258,000 of us are dead for no reason at all, except a lazy president who thought maybe it would be easier to let grandma die than it would be to do the right thing and take care of this country. You guys, I'm 63 years old. You can see me. I'm Black. I'm female. I'm poor. I am 3 times more likely than the general population to die of this virus. And I am enraged. How dare you tell me that your intention is to kill me? But if that ain't enough, I want y'all to know I got a grandbaby. I got a grandbaby that's so precious to me. My baby, he can't see and he can't hear. My baby, he's learning disabled, but he loves to sing and he loves to dance. He's 3 times more likely than I am to die from this virus. And do y'all know that we have standard of care practices in this state and in this country that say that some person, some generic human being gets to decide if my grandchild's life is worth saving, gets to decide if my baby should live, and we ain't doing nothing about it. So yeah, there's tears running down my face. But y'all, we are here to demand that they do something about this COVID now. We are here to demand that people do not get put out of their houses and left on the street. This is the United States of America, the richest nation in the history of the world. With tears running down my face, I say we cannot cry for our dead until we fight for the lives of our living.
Thank you so much. And indeed, I think it's on those notes that we end this caravan. We are indeed mourning. We are mourning. We are crying out. We are remembering. We are remembering all those who have died, the 257,000 who have died from COVID, the 250,000 who die every year from poverty and inequality, those that die from systemic racism, those who die from ecological devastation, those who die from military and a war economy. And we're saying that it does not have to be this way. So I'm hoping that folks, great love and appreciation for all of the states, all of the leaders who are a part of this campaign, who came out strong in these caravans, who rose up and said, we're going to mourn and we're going to keep on organizing. And just one more reminder. So please join us at 6 p.m. Eastern time today. Join us from the steps of the National City Christian Church as we continue this mourning. And mourn throughout this week and send out this petition and send in your names and your photos, because we remember. We remember. We will not forget. And may our lives, the fact that we are still here on this earth, be about fighting for those who have died and for those who are still alive. We will not be silent. Thank you for joining us. Thank you for everyone for organizing. Forward together, not one step back.